So what is question one? Question one is a ballot question that was brought to us as voters by the Massachusetts Nurses Association. The Massachusetts Nurses Association represents about 25% of the nurses in Massachusetts, so it certainly doesn't represent us all. It's a very rigid government mandate that would impose a set or prefixed staffing ratio for hospitals. This one-size-fits-all approach to hospital nursing staffing ratios really, for me, removes the decision-making and critical thinking that I first learned as a nurse about patient acuity and assessment of patients and planning my care. It now puts that in the government's hands, and the government tells me how many patients I should have, not my own assessment and care planning for that patient. You could be taking your father to the emergency room tomorrow, and they turn you away because there's not enough RNs in that emergency department per the new mandated staffing ratios that the government will institute effective January 1st. He goes to the next ED and he dies en route. The nurse-to-patient ratios are RN and patient specific. It does not in any way capture LPNs or ancillary staff. If you're a psychiatric patient in a hospital, they're expecting that there's one RN to every 5 patients. In the ER, it's a range from a nurse having 1 to 5 patients. My first question was, where would the hospital get these nurses? And they're going to get them from all of us. From public schools, from hospice, from home care, from skilled nursing facilities. We're already short about 1,200 RNs in the Commonwealth of Massachusetts to fill the current positions. I've done staffing in my career, and I'm not sure how in 37 days we would get that many RNs to cover the hospital mandated staffing ratios. Hospitals have already said they could close. They could decrease access to services. The ER wait times will increase. What happens if the hospital can't comply and doesn't comply? There's a monetary penalty of up to $25,000 fine if they don't have enough nurses and they take care of patients outside of those ratios. There's really no scientific research stating that the ratios would improve quality of care. And a couple people said to me, well, they did this in California, Jill. But by what I've researched, California's mandate was a bit different, and there's no evidence there that the quality of care has improved. Right now, Massachusetts ranks one of the highest in the nation in quality. They're estimating a $1 billion spend if this law goes into place, which is only going to be passed back to us because as consumers and as the healthcare industry, we're going to have to absorb the higher insurance costs, the higher taxes, and the money that it'll take to follow this mandate. In my opinion, I think this is truly going to threaten our survival, and there's a whole bunch of organizations that support voting no on one. Every hospital in Massachusetts is opposed to this. The American Nurses Association, the Massachusetts branch, the Infusion Nurse Society, the Massachusetts Medical Society, and the Massachusetts College of Emergency Physicians. It's a government plan. It's a mandated staffing ratio. It's going to affect the people that you care about and care for. It's not the plan that I would vote for.